Good evening, healthcare team. My name is T.Johnson. Today, I will present a communication strategic plan for this organization to enhance communication between the healthcare provider and patients. Your feedback are welcome to participate in the strategic planning. Each individual will have a copy of the PowerPoint slide in your folder to review and take notes. Based off on the current patient certification, 45 out of 100 patients responded on a delay in lab results and discharge planning during hospitalization. Communication plays a critical role in management, whether the purpose is to inform the employees on new policies and procedures, update the healthcare team on new standards of patient care, or to prepare for an emergency or life-threatening situation. The purpose of implementing a communication strategic plan is to ensure effective communication flow in an upward and a downward situation, to inform stakeholders of urgent information, and to communicate day-to-day operation to the healthcare team. The organization mission, vision, values, and strategic goals will help the stakeholder understand the importance of communication strategy. Healthcare providers will be able to communicate effectively among staff and patients within 90 days after attending the communication and customer service training by November 2019. The communication that we currently use is great, but it just really needs to be enhanced. Utilizing effective communication can increase customer service. It can improve communication during admission and discharge, deliver quality customer service, and also provide accurate and timely information. Based off on the SWOT analyst that was completed, the information that have been reviewed far as like the strengths, healthcare providers conduct daily rounds to communicate patient plan care with the nurse and staff, clinical documentation reflecting patient awareness of plan of care, customer service sent electronically upon patient clinical visit or inpatient discharge. So weaknesses that we may need to work on is communication barriers, such as if patients speak a different language, we need to have an interpreter to be on board. Lack of face-to-face communication at the clinical rounds, meaning that we need to see patients multiple times throughout the day. Also, providers returning urgent nursing messages within 45 minutes instead of 15 minutes. If the provider is currently in a surgical procedure, then they may have an alternate, such as a medical student or intern, to answer those calls promptly. Also, a weakness that was communicated was the provider does not communicate stat orders in a timely manner, meaning the order may be submitted electronically, but also a telephone call need to be communicated to the charged nurse to verify the order or to clarify the order, and also to implement the order for patient care. Opportunities for us would be healthcare providers follow up with patients monthly or quarterly via telephone or clinical appointment, conducting a customer service telephone questionnaire survey, incorporate communication into the organization vision and mission statement. Also using a Vocera, which is a electronically device, such as a verbal pages system to communicate effectively to the patient or to the nursing care team. Some threats that may encounter in regards to effective communication will be patient unable to complete customer service system survey due to not having a computer, staff turnover, meaning that we will need to have additional training to ensure all staff members have received the information, and also healthcare providers not responding to their emails or customer feedback within 7 days. The communication strategic plan will provide communication material for employees and patients. Utilizing effective communication can increase morale, job certification, builds employee morale, certification engagement, improve process and procedure compliance, and help prevent the chances of misunderstanding. As a team, the stakeholder will meet biweekly to discuss communication ideas, data based off on the patient and employee feedback. Qualitative and quantitative data would be used to evaluate employees and patient attitudes, to review patient care services, and also employee feedback. Thank you all for attending this presentation, and please feel free to discuss any ideas or suggestions that you may have. This presentation is concluded, and thank you all so much for attending. Good night.